I'm so elated to meet you in the program of 1 minute please. What are the consequences of thyroxine overdose? If someone consumes excess thyroxine, for example, if they consume more than 300 microgram of thyroxine, then probably they may harbor host of symptoms, including nervousness and irritability and enormous amount of sweating and loose stools. The signs including they will have tachycardia, to some extent arrhythmias, and they will have polyuria. So peculiarly, they may have polyuria secondary to excess thyroxine consumption. 1 week before, we received a patient, 28 years old female, consumed 125 microgram of thyroxine tablets, about 125 in numbers. She presented with tachycardia and she was quite anxious, intermittent sweating. In addition to that, she passed urine somewhere around 5000 to 6000 ml almost for 4 to 5 days. Then it has been found that the excessive thyroid hormones could produce polyuria with few mechanisms, namely, when you consume excessive thyroid hormones, it increases your heart rate. Because of hyperdynamic circulation, kidney receives more amount of blood flow, resulting in polyuria. And the second one, the excess thyroxine consumption can downgrade your aquaporin channels, resulting in decreased ADH action over the kidney, resulting in polyuria. So how will you manage? If someone consumes thyroxine tablet, the first most important is gastrointestinal decontamination. If they come to hospital within 1 hour, then probably you can execute stomach wash with activated charcoal. This activated charcoal absorbs the particles of thyroxine. And second one, you can give cholestyramine. So basically cholestyramine, which was originally designed for decreased cholesterol production. In fact, it is very useful in the management of dyslipidemia. Here, it is useful in such a way that the non-absorbable resin simply binds with the thyroxine tablet. So it can be given 4 gram every 6 hourly. It is available in sachets. It should be mixed in water. And second one, you can give beta blocker. So how beta blocker helps in thyroxine overdose? So beta blocker will decrease the heart rate, which can prevent arrhythmias. Among the beta blocker, we prefer propranolol, which is a non-selective beta blocker. So how it is useful? As compared to routine selective beta blocker, this non-selective beta blocker propranolol not only decreases the heart rate and prevents the onset of arrhythmias, it is capable of preventing the conversion of T4 into T3, which is considered as an active physiological hormone. Then apart from that, you can give steroids, especially dexamethasone 4 milligram IV daily once, which can prevent the conversion of T4 into T3, which is considered as an active hormone. Then apart from that, you can give propylthiouracil. So propylthiouracil can be initiated 50 milligram 8th hourly or 100 milligram 8th hourly, which can also prevent the conversion of T4 into T3. Apart from that, PTU can prevent new synthesis of thyroid hormones as well. So what you have to remember that most of the onset of toxic symptoms secondary to thyroxine consumption will appear only on 3rd and 4th day. So premature discharge of the patient should be avoided, especially on 1st and 2nd day. So what is the take home message? If someone consumes thyroxine excess dose, especially more than 3000 microgram, patient deserves intensive treatment. And second one, all the toxic symptoms of thyroid excess dose can appear only on 3rd and 4th day. And third one, thyroxine excess overdose can be managed with gastrointestinal decontamination and beta blocker, especially propranolol, and steroid, especially dexamethasone and propylthiouracil. As I told you earlier, we received one patient with consumption of 125 tablets of 125 microgram. In fact, we were able to successfully treat the patient and discharge the patient, but during the management, I was given useful insight by various doctors. I would like to express my deep gratitude to those doctors at this juncture, namely Dr. Mahendran, Senior Intensivist in SIMS Hospital, Dr. Rajesh, Endocrinologist, Nalandur, and Dr. Adeline, Assistant Professor Endocrinology in SRMC, and Dr. Shruti, Senior Endocrinologist in Rail Hospital. Thank you.